when she comes and tells me it's hepatitis A, I was like, whoa, is that even a thing? I was told that I had acidity, even after telling the doctor I did. So I was given antacids and painkiller. And then now from there, I remember I was taking a lot of water though. So, and then from there is when I went back to my place. So I think around the following day, I talked to my mom and told her I wasn't feeling well. So she told me, let's do this, let's meet in town and go to some chemist where we can get some tests done so we can get medication, Yeah, so we went, I got some tests done, but I remember the pharmacist said, we won't give you medicine right now. Just go to Kenyatta National Hospital, maybe like the private ward, and go see a doctor because it may not be, we don't want to give you any medicine now. We went to some lady, she was called Dr. Bat. I was in so much pain. I remember even walking to some extent was a problem. It was pain. I remember I would just touch my stomach because of how much pain it was. So when we went and met her, she started pressing around my stomach region, and I remember when she pressed around under my right lung, it was painful. So she sent us to do some tests. I went back with the results that we had, and then she gave us some medicine and said, you just use this one because I suspect it might be hepatitis. I was like, what? What do you mean? Because you see, hepatitis isn't something that you normally hear about. I think hepatitis, the only time I heard about it was during the immunization schedule, the one you taught in school for kids. And that's hepatitis B. So when she comes and tells me it's hepatitis A, I was like, whoa, is that even a thing, Because it's not something that you're told about. It's not something that we hear about normally.
Hepatitis essentially is an inflammation of the liver. It has got several causes. Over 80 to 90% of causes are because of the hepatitis viruses. So there are several different types of viruses. The commonest we have in Kenya is hepatitis A and hepatitis B. There are other types of hepatitis viruses, including hepatitis C, hepatitis D, which goes together, hepatitis B, and hepatitis E. All those are much more rare. So the commonest in over 80% of cases would be hepatitis A and hepatitis B. Hepatitis A typically causes what we call acute hepatitis. Acute hepatitis means it's hepatitis that occurs for a short duration of time. So it can actually present even flu-like symptoms. A lot of people might have been exposed to hepatitis A and did not even realize they actually had it. Especially if it becomes more severe, you would have to go to the hospital. For example, if you start noticing your urine changing color, or your eyes becoming yellow, or your skin becoming itchy, those are the most severe cases of acute hepatitis A. Chronic hepatitis basically means it's something that you've had for a long time, usually more than 6 months. It could even be for years. And that is what we have actually in Kenya. We've got a lot of chronic hepatitis B. Hepatitis A doesn't become chronic. It's self-limiting, and usually you get full recovery. But hepatitis B, if you get it in childhood, you're more likely for it to last longer and become chronic. If you get it in adulthood, most adults are able to clear it. So it's very prevalent in our country. We actually have a hyperendemic for hepatitis B, which means more than 8% of the population have it. Unfortunately, we do not have routine testing for hepatitis B done. The problem with it, you can actually have it in your body and you feel completely well. And everything else will be normal. Your blood pressure is normal, your heart rate is normal, your sugar is normal. So it gets missed for many years for a lot of people. So most people have never been tested for hepatitis B. But you'll find quite a lot of people actually have it. The problem with hepatitis B is also the commonest cause of liver cancer. And it's something that's potentially preventable. All you have to do is get the vaccination. Unfortunately, the vaccination that is given from birth only came available around 2004, 2005, which means anybody born before that never got into that vaccination program and did not get vaccinated against hepatitis B. So if you're part of this population, you should go to the hospital and get tested. You might actually be having hepatitis B. You could be heparin virus that can eventually give you liver cancer or other complications of hepatitis B. You can get chronic liver disease, which basically means it stays for so long and slowly starts to damage the liver. So these are the people you'll see who start gaining weight, not because they're getting fatter, but because they're getting more water in the body. So they get something called ascites, because the liver is not able to basically deal with that water as effectively as it could be. They could get yellowness of the eyes as the liver becomes worse, or even as they start to get liver cancer. They could start becoming cachectic, when you see the bones becoming more prominent. These could also be signs of cancer. They could become confused. They could start vomiting blood. Of course, this takes a very long time. This will take well over a decade, which means you could be having this and it could be slowly damaging your body. And a lot of people, unfortunately, will discover this when they're already quite sick. And by the time you're quite sick, this is a very serious disease that might even require a liver transplant. We do blood tests. So we check for what we call hepatitis B surface antigen, which is something that is released in the body that can be detected in the blood. If it is positive, that means you've already had hepatitis B and you need more subsequent tests for us to find out, now that it's positive, how much viral load is there? Has it compromised the function of the liver and so forth? If it is negative, it doesn't necessarily mean that you've ever had hepatitis B before and you cleared it. It could also mean you've never been exposed. So there's a test we do called the antibody test. The antibody test tells us whether you've had past infection. So if your surface antigen is negative, you should do an antibody test. If the antibody test is also negative, you need to be vaccinated. Fortunately, hepatitis B can spread very easily. In fact, it's more than 100 times more infectious than HIV. So it can be spread through sexual contact, it can be spread through secretions like saliva, including sweat. So even children playing around and sweating can actually infect each other, even through handshakes if your hands are sweaty. So that is how infectious it is. If you've had, for example, a liver transplant because of hepatitis B, and you're taking these drugs to prevent rejection by the body, this is immunosuppressive. So patients who have had a transplant and are on medication ideally should consider themselves at high risk of getting COVID-19. Right, so I would strongly advise anybody born in the 90s and earlier to actually go and have their screening done. And if you're born within the millennium, from the millennials onwards, just confirm that the vaccination was actually given. So everybody should have a vaccine card. If you might have misplaced it, whichever hospital you are going in keeps those records.